through this opening. It allows food and medication to be given directly into the stomach instead of through your mouth. G-tubes can either be permanent or they can be temporary. Why would someone need a G-tube? Basically, to maintain adequate nutrition when advanced GI conditions make feeding difficult. Conditions would include severe Crohn's disease, gastrointestinal cancer, intestinal failure, bowel obstruction, and ulcerative colitis. Some common complications that you could see: stomach-site infection or minor skin issues, constipation or diarrhea, dehydration, blockages in the feeding tube, displacement. Most of these complications are minor, such as displacement and site infection. Some studies have shown that older adults with comorbid illnesses or have a history of aspiration will have more complications than younger. Caring for the G-tube. You want to make sure that you always keep it protected, keep it stable to avoid displacement. Flush the tube daily with 20 to 30 cc's, approximately 1 ounce of water to keep the tube open. You're going to clean the skin around the site once or twice daily with a mild hand soap, and make sure you keep the skin around the site dry. Administering medication. Always check with the doctor before taking any medication through the G-tube. Inappropriate drug selection can cause potential toxicity, reduce efficacy, and cause tube obstruction. Liquid forms of medication work best. If it's not possible to get the liquid form of medication, you need to make sure that you can crush the medication and dilute it with water. You do not want to crush pills with SR at the end of it or sustained release in the name. Again, you're going to make sure that you flush the G-tube after giving medication. There's a picture of what a flush looks like. Feeding via the G-tube. We have a bolus feeding. That's a feeding over a short period of time. Generally, if you get bolus feedings, they last about 20 minutes, and most people who get bolus feedings, they get a feeding every 3 hours. Then there's the continuous feeding, which is a feeding over a long period of time. A pump is needed to allow for a slow and steady rate. Continuous feedings usually last about 4 to 6 hours. Always follow the doctor's orders for feeding. If required, you're going to want to check for residual or leftover feedings before the feeding. You're going to make sure that the client is sitting or propped up during feeding, and then you will flush the tube after feeding. Documentation that we would look for a client with a G-tube. You're going to do skin assessments every shift. Make sure there's no skin breakdown or signs of infection. Your medication administration record, residual tracking if required, a pain tracking. The nurse should come and listen for lung sounds to make sure proper placement. You'll also look for intake and output and do a weight. That's all I got. Any questions?
I don't see any questions so far. If anybody has questions specific to G-tubes that they would like to ask, you can type them in the chat box, and I can keep an eye out and see if any come in.
Okay. My contact information is on there if anybody has any questions after the call.
Okay, I see a question. What is the difference of a Mickey versus other placement?
What is the difference of a what?
Of a Mickey versus other placement? Were you able to understand my question?
What is the difference of a Mickey versus different placement?
Yeah, versus a different type of placement. I know we've had some people that have what's called like the Mickey or the Mickey button, I think.
Right. That's mostly for children,
Okay.
so they'll have like a smaller size. The Mickey gets
Is
changed
that
every 3 to 4 months.
so? Is that usually better for someone with a smaller anatomy then? Is that why it's usually for children?
Yes.
Okay. I see another question. Are there complications to worry about if the tube falls out and was already set to be removed?
Well, the stoma could close up. The stoma is a slow healer, so it's not going to automatically close up. So I would just make sure that they get in to see the doctor right away, or at least let the doctor know like it came out, especially if it's due to be taken out.
Okay. And then the person that was asking about the Mickey said that she does have adults that have them.
Are they larger adults? I don't see the chat box thing. So.
Yeah. Yeah. And then I had someone that asked if you could explain the types of documentation and some red flags that maybe we should be aware of.
Here's the documentation one.
Okay. Are there any, like as a case manager coming in and looking over the documentation for a G-tube, or, looking at the person themselves, are there any red flags that you can think of that maybe we should be looking for or that would alert us to maybe a possible issue?
The skin assessment is going to be your biggest one. And then also pain. If they appear to be in any kind of pain, it could be a displacement. And just like making sure that you're monitoring for infection.
And then, yeah, so for the skin assessment, that would go hand in hand with looking for infection, correct?
Correct. Yep, you're going to want to make sure that it's not bright red or, even worst case, turning purplish color.
And then, like with the intake and output, should we see a pretty consistent correlation between what they're taking in and the output with the documentation?
Yes.
Okay. I had someone ask, what is the difference between a G-tube and a J-tube?
G-tube and a J-tube?
Uh-huh.
Just the placement.
Okay, so the J-tube is placed in a different part of the stomach or like the intestine?
Correct.
Okay. And then how often should staff with providers be trained on the G-tube, do you think?
Well, we, as a provider, we make sure that we do annual training. One of our other operations, they do training every 3 months. They are in a different state, though, so they have stricter guidelines.
Okay. This is a question of my own, and it may be difficult for you to answer, but I know that you had mentioned with the NICI that it's usually children that have them, and then I used to have a lady on my caseload that was very tiny, and because of the makeup of her anatomy, and really because she was tiny, they had a lot of issues with the G tube coming out, and then they would usually have to take her to the emergency room to get it placed back in. So I'm just wondering, for somebody like that, with the Nikki might have been a better option. Like I said, I know that's kind of a hard question for you to answer, but it was just something that I thought of.
Yeah, I I wouldn't even feel comfortable saying that.
Yeah.
There's different, if if it's coming out on a regular basis, then the doctor probably should have looked into doing something different or maybe placing it somewhere else.
Okay. I had someone ask, what type of food do you put in a G tube?
It is I don't know, it's like a brownish liquid.
It's kind of like a formula almost, right? Kind of.
Yeah. That's
Okay.
basically what it looks like, is formula.
Yeah.
It's an interesting looking liquid.
Yeah. And then I did have someone else ask, what can you do if you have an adult who pulls out feeding tube? Any suggestions?
Oh, no. I have no suggestions. Just making sure that it is as stable as you possibly can keep it. We do have lots of people who have different things coming out of them that pull on them all the time. You just have to make sure that the staff is constantly monitoring and, you know.
I was thinking that some people have, and I can't think of what it's called, but they do have maybe like a clip or something that they put on to try to make it more stable, to make it more difficult to pull out. Does that make sense?
Yeah.
Okay. What are those? Do you know what those are called?
No, not offhand.
Like a binder maybe, or what
Do
type of errors?
abdominal binders for G-tubes.
Okay. What type of errors or situations usually cause the majority of complications? Somebody asked.
What situation?
What type of errors or situations usually cause the majority of complications? Like what do you often see that could lead to complications, like an error on the part of the caretaker or any other situations that you could think of?
Just not keeping the site clean. That's the biggest one. Not keeping the site clean, keeping the client hydrated, especially if they are NCO. If they're not allowed to consume anything by mouth, then dehydration is the big one. But site infection is probably the biggest thing that we see.
Does the liquid, the feeding that they receive, does that help with the hydration? Or do you have to take more steps, like with the swabbing of the mouth and stuff, to keep them, if they're MPO, to keep them from becoming dehydrated?
Swabbing in the mouth is a big thing. But between the flushes and the feeding, they usually can stay hydrated pretty well. The more of the swabbing of the mouth is just to keep the mouth, moist, prevent.
Okay. And then somebody asked, what are some factors that go into deciding if someone gets a J tube, G tube, or GJ tube?
It all depends on the doctor, where their issue is. Let's see if I can get back to where the issue is, what would cause them to have the need for a G tube or a J tube.
And yeah, the the difference in those is where they're placed in the intestines, correct? So that would make sense that it would depend on, the condition. Sorry. And then someone asked, how often should you clean the G-tube?
It basically depends on the doctor. You're going to flush it daily. You want to make sure that you keep, the stoma area clean every day.
Okay.
They usually get changed like every 12 to 24 months. So.
Okay, that was the next question. How often are they changed by the doctor?
The initial placement should last for 3 to 4 months before it's changed. And then after that, it'll go every 1 to 2 years.
Okay. I'm looking to see if there's any more questions. I'm still scrolling just to make sure I didn't miss anybody. I think here's a new one. I think there was a typing error in the question, but it's asking, I think what it's asking is, how does weight affect the G-tube?
How does weight affect the G-tube?
Yeah, I'm not real sure what the question is.
Maybe they're asking about the documentation. Weight
I'm
shouldn't
not
really
sure.
affect the G-tube. It probably would affect the size of the tube, because there are different size tubes. As far as like the documentation of weight, we would want to make sure that the client is, maintaining their weight or gaining weight. We don't want them to be losing weight because their diet was switched.
Okay. And she did clarify, how does weight of the person? I think what maybe she's asking is, if they're a heavier person or they're like a thinner person, does that affect the G-tube in any way?
No.
Okay. It's more what you were saying is we need to be monitoring the weight to make sure they're not losing, to make sure they get enough nutrition.
Correct.
Okay. What are typical supplies needed to care for a G-tube?
Soap and water to keep the area clean. You would want tape that is not going to cause any skin issues, so you can tape it down in place. The proper feeding and water to flush it.
And it looks like from the picture that you shared that you use like a syringe to do the flush. Like, it looks like a pretty big one, actually. Okay.
Correct. It's like 60 ml, 100 ml. They're really big.
And is that what you typically use to flush the G-tube every day? Is that big of a syringe?
Yes.
Okay. Okay. I don't think I'm seeing any more questions, but I will do some scrolling some more and see. Oh, somebody asked, should staff be wearing gloves when flushing the G-tube?
Absolutely. I don't know why this picture does not show gloves, but yes, absolutely.
Oh.
Anytime you are doing anything with a client, I suggest wearing gloves to begin with. But
All right, I am not seeing any more questions. I believe that we've gone through all the questions. Great questions, though, everybody. You guys really asked some really good questions to clarify some more of the information. And just making sure there's not anything new coming in. Okay, I don't see any new questions. Nicole, thank you so much for putting this together and for asking all the questions that everybody had. And thank you, everybody, for joining today. As I said, you should be getting an email within the next couple of days to confirm your attendance today. So unless anybody has anything else, I think that's going to conclude the training for today.
thank you, everyone.
All right, thank you.
Bye.
Bye.